COVID-19. There are reports out that COVID-19 is affecting the BAME community rather more than others. My name's Councillor James Dalton, and this is the Democracy Emergency Room. Okay, we're going to start with this report from the BBC. Coronavirus report on BAME COVID-19 deaths sparks call for action. Doctors have called for recommendations of a report into the impact of COVID-19 on Black, Asian and minority ethnic people to be implemented immediately. Right, report to be implemented immediately. BMA critical to carry out risk assessments of vulnerable groups and protect them at work. Right, so here we have a report. Let's have a look. What else is he going to be saying? Blah, 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 recommendations, blah, 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 fair and right thing to do for our population. Said, blah, blah, 90% of doctors who have died during the pandemic were of BAME backgrounds. Doctors from the community were 3 times as likely to feel, say they had felt pressure to work without 3 times as likely to say something. Well, I'm not too sure if that's any relevance. Anyway, racism could play a part. Here we go. Virus death risk is high for ethnic minorities. BAME people dying from coronavirus. Why are more? Right. Greatest risk. Blah 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 blah. Anyway, they've got a report, and they want to implement it. Let's have a look at the report. Right. So let's have a look at this report. I've got something highlighted. We'll come back to that. That's on page 8. Remember for reference purposes. But this report is beyond the data. Beyond the data. What data? Anyway, understanding the impact of COVID-19 on BAME groups. Right, let's get to it. About Public Health England, the short one. What is Public Health England, for those of you who don't know? Part of our NHS, is it? Let's see. Public Health England exists to protect and improve the nation's health and well-being. Excellent. Excellent. We've got a protector and an improver of the nation's health and well-being, and reduce health inequalities. No, I don't like that, because then you've got to find somebody who determines what their health inequalities are, and then it gets all dirty and lots of people get paid to do silly jobs. Anyway, I like this one. Improve the nation's health and well-being. If we focus on that, we'll do all right. We do this through world-leading science. Interesting, because we will be coming research, knowledge and intelligence, advocacy, partnerships and delivery of specialist public health services. Right, world-leading science, we'll be coming back to that as well. We are currently an executive agency. Executive, they're in charge of executing, of the Department of Health and Social Care. So they are an executive branch of a government department, and a distinct delivery organisation with operational autonomy. They're in charge. The government's not in charge. The department's not in charge. They have operational autonomy. We provide government, local government, the NHS, Parliament, industry and the public with evidence-based, professional, scientific and delivery, expertise and support. Right, okay. Okay, and this is Public Health England. There's the address, the website's Facebook page, Crown Copyright. PHE supports the UN Sustainable Development Goals, does it now? And Sustainable Development Goals with a very nice little rainbow ring. Anyway, published, what's this? Corporate member of the Plain English campaign. Committed to clearer communication. Right, clearer communication. Beyond data, understanding the impact of COVID-19 on BAME groups. 69 pages long. Not a good start for plain English. Should be able to get a nice little summary on a sheet of A4 here, but what have we got? Executive summary 4, and then acknowledgements 12. So we've got crumbs. I'm not going to pile through all this document, because obviously nobody ever does pile through these documents. I have, sadly. Anyway, that's by the by. Corporate member of the Plain English campaign. One thing that government departments always do is make sure that the documents they give you are so packed full of nonsense and waffle that nobody actually reads through them. Let's see, who's written this? Let's find out who's written this. Page 12, I think. Acknowledgements. Here we go. Acknowledgements. Professor Kevin Fenton. Right. Again, we'll come back to him. Now, in the executive summary, something did crop up that seemed to be of relevance, which we pointed out. Go back to page 8, and it's down here. In the section on moving forward, we've got a snippet of actual information that might be of relevance to people. Further consideration needs to be given to factors such as diet, vitamin D and housing. Guidance currently recommends that individuals with limited sunlight exposure take a daily supplement of vitamin D. Right, okay, daily supplement of vitamin D. Let's have a look at this a little bit further, because whilst I'm an engineer, you do keep on top of basic scientific facts and developments. And one thing that we do know, if we go to our friends in the world of science, which we used to do, take advice from scientists, and remember that's what the that's what Public Health England are committed to doing. World-leading science, research and knowledge. Right, world-leading science, research and knowledge. Let's get to it. This is a document from 2015, February, and there's many. You can go and have a look on whatever your search engine might be on vitamin D and STDs, vitamin V and viruses. Here's one, vitamin D and race. Vitamin D and race, you can click down there. You'll get the fake news stuff rammed at the top, the things that the salespeople want you to see, but you'll you'll see political stuff. Right. Here's an academic paper, for instance, reports estimates the US population prevalence of risk of deficiency or inadequacy of vitamin D by sex, age, race, and Hispanic origin, and intake of vitamin D. So you can have a look for yourselves. I've had a bit of a scan through. There's one here from the BBC. We will be coming back to that. But here's a medical paper that you can find. And let's find it now. Here we go. Vitamin D deficiency in minority populations. Abstract. Objective. Black and Hispanic individuals synthesize less vitamin D per unit sun exposure than white individuals. Now, this is known science. The relationship between UV radiation and vitamin D insufficiency in minorities has not been well explored, so it's a subject of ongoing scientific advancement. However, what is known is that wintertime vitamin D insufficiency is pervasive among minority populations and not uncommon among non-Hispanic whites. Now, this obviously gets is more because of the nature of the production of vitamin D and its relationship to sun exposure, whilst not well understood. Obviously, in the northern hemisphere, you get less sunlight, so this issue is accentuated. So let's just have a look. It does talk about the numericals, but get advice from your doctor. Vitamin D supplements are one terrific thing that you can be doing to improve your immune system. That's number one thing to take away from this video. So vitamin D, it's known science. We should, in a time of a viral pandemic, be giving this advice out, more so because the studies are being undertaken, they are being done, and what we're finding is vitamin D is effective for COVID-19. Real-time meta-analysis of 50 studies. Again, you can look at the site here. It's got all sorts of information about all sorts of different products. But this is obviously a vitamin D study. And it's not a study, sorry, it's a meta-analysis. It gathers all the scientific studies that have been done and collates their findings and comes up with a conclusion. So you can read it through at your leisure. There's your site. Let's just go straight to the conclusion. Let's watch the conclusion say. And it is important to note that it looks at 3 phases where the vitamin D is used in advance of anybody getting infected. In other words, if somebody's got given vitamin D and they've got a high vitamin D level, then they get an improvement in their outcome. Probably less likely to get into a stage of treatment, but again, early treatment and late treatment. So when vitamin D is given as a medication or whilst in a hospital or doctor's setting or GP setting, and again late treatment. So the conclusion, here we go. Vitamin D is an effective treatment for COVID-19. Random effects. In other words, this isn't, again, new science. Vitamin D is known to have a specific effect on the immune system. And we know that a good 40 nanograms per milliliter of vitamin D is a level whereby you're going to have your cells are going to have sufficient content to be protecting themselves more readily against viral infections. Anyway, let's move on. Let's just go back to our report on our leading science. So they did get in there this thing about vitamin D on page 8. Not a lot else in this document. You do find out that there's lots and lots of people want lots of money to do lots and lots of research on, sadly, structural racism. Recommendation throughout the stakeholder engagement exercise, it was both clearly and consistently expressed that without explicit consideration of ethnicity, racism and structural disadvantage in our responses to COVID-19, it was stressed that without explicit consideration of those things and tackling health inequalities, there is a risk of partial understanding of the processes producing poor health outcomes and ineffective intervention. This is just nonsense. Look at the problem, suss out what the problem is, and come up with the solutions. So, next I want to talk about what's going on with this leadership. Professor Kevin Fenton, we're going to have a look at him. So Kevin Fenton, here he is, government website, bibliography. Kevin Fenton, Public Health England. Public Health roles, Strategic Director, Wellbeing, Public Health, Borough of Southwark. Joining the PHE board in 2020, so he's a recent arrival. Right, interesting. Right, so the Council's Public Health Programmes, Social Regeneration, PHE Senior Advisor. Here we go, Senior Advisor for HIV virus. Interesting crossover with HIV and coronaviruses, immunology, that kind of expertise. This is good. Previously, National Area of Health for health checks. Here we go. Between 2005 and 2012, Fenton was National Centre for HIV/AIDS, viral hepatitis, STD, and TB prevention. Right, so he should be on top of his science. He should certainly be aware of, what could simply be, put out in terms of public information, certainly on vitamin D. And he's really ideally suited to understanding the up-to-date science. So what's going on? Well, let's see what's going on. We've got a report in the Evening Standard from 4 days ago, which is the 17th of February. Structural racism partly to blame for high BAME COVID deaths, warns Chief. Chief. Structural racism, partly to blame disproportionately high numbers. London's public health chief warned today. So, calling for landmark reforms in the wake of the pandemic, Professor Kevin Fenton stressed that poor housing, overcrowding, and unemployment factors had left people from ethnic minority groups vulnerable to the virus. Come on, Kevin. Come on, Kevin. If there's high incidence of COVID deaths, get the word out. I mean, I don't know. I'm not hearing this public health message. I'm not hearing how vitamin D that's effective against COVID-19. What's the excuse? Why are they? This guy is paid a lot of money. Now, here he is, by the way, Kevin Fenton. He does get in the papers, and when he gets in the papers, as he did on the 17th, it's structural racism. Everything's always structural racism. I don't know what's wrong with these people. Wikipedia page, it tells you where he's worked for, what his expertise are in. From Glasgow, born in Glasgow, grew up in the West Indies, medical school in Montego Bay. Anyway, communicable. So he worked for the CDC in the United States of America. So he should have this basic knowledge on vitamin D deficiency and the impact of low vitamin D on your immune system. But he's not getting the word out. Here he is in The Guardian. Kevin Fenton. Oh, hang on. Kevin Fenton, sorry. I don't know how much he earns, but I can tell you that Wikipedia tell you that he's paid a salary that, well, most people can't even imagine. £175,000 a year for holding an office. And he's got the opportunity to help people's healths by getting a basic message out, and it's not happening. Here he is in The Guardian back in November, and making political capital out of COVID and his newfound position as a chief cheese in the autonomous Public Health England. Accountable to whom? Second most influential black person in the UK. Can you talk about vitamin D, please, Kevin? Professor Kevin Fenton, maybe he does. Well, you can tell he doesn't. Regional director has lived in a lot of places. Oh, he's lived in me. In the UK, where he gained his PhD, particularly moving humbled. Influential, right? Oh yeah. Oh well, everybody loves Lewis, don't they? And followed by the grime artist Stormzy, another stalwart of the heroes for the young people of today. Honoured people, honoured power, time of injustice, debate about racial injustice. It's nice to be recognised by blah, 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 cultural icons, health service, black leadership. It's such a tragedy. There's great people around, and these people who just use their skin colour to further themselves. Authored 2 reports on that. Second, which included evidence from 4,000 people, including Britain's BAME groups. Remember, back in July when this stuff kicked off, British Medical Association, good old Dr. Nagpal, Kevin Fenton in his position at Public Health England. This was obviously when the masks were coming in, when the staged riots were going on in London, when the Black Lives Matter money raising vehicle, and by the way, it's very effective in raising a lot of money. Sadly, these people do not care about what's going on in hospitals, what people can be doing simply for not a lot of money at all, doing to protect themselves against COVID-19. I've had enough of talking about Kevin. Let's wrap this up about vitamin D and structural racism and COVID-19. Structural racism. Okay, let's hit it with the summary. Vitamin D, COVID, Black and Asian minority ethnicity summary. Structural racism. This is a distraction. Talking about racism when people are dying and there are simple things that people can do to help themselves is not helping at all. Talk about vitamins D and C, zinc, and other ways to strengthen immunity and health. Get your advice from a doctor, not from other people, including me, but look into this vitamin D. Other ways to strengthen immunity and health. Structural racism, if it exists, has become a deadly distraction in this time of COVID. Politically motivated with tragic ongoing outcomes. The United Kingdom, evidently, if you believe everything that you read in the papers, is one of the worst countries when it comes to how we've responded to this in terms of outcome. The numbers tell us everything, that our institutions have failed to manage this as well as institutions in other countries. What we know, wintertime vitamin D insufficiency is pervasive among minority populations and not uncommon among non-Hispanic whites. In other words, we can all do with a bit more vitamin D. We need to be more aware of this and be doing something, whether through diet or supplementary vitamin pills, to up our vitamin D levels to protect ourselves against all sorts of viral infections, including COVID-19, because vitamin D is an effective treatment for COVID-19, as the random effects meta-analysis of the 16 treatment studies to date results tell us right. So why is Professor Kevin Fenton in his role with Public Health England not promoting this information? I do not know. Get your act together, Kevin Fenton. By ensuring vitamin D levels are maintained, each of us will have immune systems better equipped to resist and fight COVID-19. If you're thinking that the wrong people are making decisions, you'd be 100% correct. Summary. Public Health England are failing to focus on what will save lives. Professor Kevin Fenton is playing politics with people's lives. Professor Kevin Fenton is particularly failing the BAME community. People are being badly served in respect of what they can easily do to improve their immune systems in the face of COVID. What we need it from a Public Health England professional is to be looking at all of us, each and every one of us. It appears that Kevin Fenton, sadly, has a different agenda, and that's one to promote this structural racism, which sadly far too many people within institutions are so keen on making money out of. It's a distraction. So you can watch our institutions continue to fail to do the basics, or you can replace the corrupt Labour Conservative Uniparty at the ballot box, which sustains and promotes this common purpose nonsense. My name's Councillor James Dalton from 5 Star Direct Democracy Party on the 21st of February 2021, and this has been the Democracy Emergency Room. Godspeed.